Good afternoon. In the room and all at the sea. This is the session about cystic fibrosis. And then Vishkan Balogh, who is from the University of Debrecen. And I can start right away. Viktória Venglovecz from Szeged, Physiological and Pathological roles in Theatria, Pancreatic, exocrine, and Endocrine.
Thank you. Thank you. It's a great honor for me to introduce this session. So thank you, Peter and Miklós, for this kind invitation. And I hope that I can give you a useful overview regarding the role of Cftr in the endocrine and exocrine pancreas. So first, direction design doesn't work.
That's good.
Good. So first, a few words about the Cftr chloride channel. The Cftr is a cyclic AMP activated chloride channel, which regulates the transepithelial salt and fluid secretion. The Cftr is localized on the apical membrane of epithelial cells in various tissues, such as the airway, the intestine, the lung, and the pancreas. Here you can see the schematic picture of Cftr. So it consists two repeated domains. Each of them consists a membrane spanning domain and a nucleotide binding domain. And the nucleotide binding domain is able to bind and hydrolyze the ATP. And between the two NBD, there is a regulatory domain which can be phosphorylated. And due to the hydrolysis of the ATP and due to the phosphorylation of this regulatory domain, the Cftr chloride channel opens. So in the pancreas, the Cftr is located on the intra-interlobular pancreatic duct. Here you can see the schematic picture of ductal cells. So the Cftr, as I mentioned, is located on the apical membrane and interact with the chloride bicarbonate exchanger. And as a result, bicarbonate-rich alkaline pancreatic fluid is secreted. So this fluid has several physiological functions. It prevents premature activation of trypsinogen. It's play a role in the neutralization of the acidic stomach contents in the duodenum, and also provide a vehicle for the transport of digestive enzymes. So in the case of inadequate function of this Cftr channel, this leads to the decrease in the bicarbonate and the fluid secretion, and this can cause cystic fibrosis or increase the risk of pancreatitis development. So maybe I do something wrong, but so as you know, acute pancreatitis is an inflammatory disorder with an incidence of 34 per 100,000 persons per year. So in most of the cases, the symptoms are mild, but in approximately 30%, moderately severe or severe pancreatitis develops with a mortality rate of 20 to 40%. Although the therapy of pancreatitis improved a lot in the last few years, there is still no specific therapy. And one of the major reasons of this is that the exact pathogenesis of the disease is not completely known. So the role of Cftr in acute pancreatitis has been arising more than 50 years ago. in a clinical study, which is conducted by Henry Sars and his colleagues. In this study, alcoholic pancreatitis patients were investigated. And in the case of falsifying pancreatitis, the presence of protein plaques in the lumen was detected, and the sodium and chloride secretion in these patients was significantly higher compared to the controls, indicating that the Cftr chloride channel probably does not work properly in these patients. So in order to confirm this hypothesis, we investigated the effect of alcohol, which is one of the major etiological factors in the development of pancreatitis, on the activity and expression of Cftr. And we also investigated whether the Cftr can provide novel therapeutic option in the treatment of pancreatitis. So this study was published by one of my PhD students, Linda Ludach, in this study using the whole cell configuration of the patch clamp technique. We showed that ethanol dose and time dependently decreased the activity of the Cftr chloride channel. And we also found that the non-oxidative metabolites of ethanol, the palmitoleic acid ethyl ester, and also the fatty acid, the palmitoleic acid, had similar effect on the Cftr activity. So in the next step, we investigated the underlying mechanism. So ATP is a key molecule in the activation of Cftr, and we found that ethanol induced a small ATP depletion in the ductal cell, whereas the ethyl ester and even the fatty acid significantly decreased the ATP level inside the cell. So in the next step, we wanted to know whether the inhibitory effect of ethanol and its metabolite is due to the depletion of intracellular ATP. Therefore, we used the mitochondrial toxin, CCCP, and glycolytic metabolism inhibitors, the deoxyglucose and iodoacetamide, and investigated the activity of Cftr in the presence of these toxins. And as shown on this chart, the Cftr activity significantly decreased due to the inhibition of the mitochondrial and glycolytic metabolism. So these results indicate that ethanol and its metabolites inhibit the Cftr chloride channel through the depletion of the intracellular ATP. So next, we tested whether if the ATP is given back to the ductal cells, whether it is able to restore the Cftr function. So we had 5 millimolar ATP through the patch pipette and found that both ethanol, the fatty acid, and the fatty acid ethyl ester was able to prevent the inhibitory effect of these agents. So these results indicate that the restoration of the energy damage by ethanol can be beneficial in pancreatitis. So ethanol not only inhibits the activity of the Cftr chloride channel, but also its expression. So it has been confirmed both experimentally and clinically in acute pancreatitis, alcoholic acute pancreatitis patients. The expression of Cftr significantly decreased at the luminal membrane of the ductal cells. And using an experimental model of pancreatitis, we also showed that the pancreatitis was more severe in those mice in which the Cftr chloride channel was knocked down. So this indicates that the restoration of the expression of Cftr can be also beneficial in pancreatitis. So recently, in the therapy of cystic fibrosis, clinically approved and available drug, the Orkambi, is used. The Orkambi contains both corrector and activator, and the treatment of the ductal cells with these agents at different time points in alone and also in combination was able to restore the expression of CFTR after the ethanol treatment, especially in the apical membrane of the ductal cells. So we also investigated the effects of Orkambi in vivo. So after the third cellular injection, we had the Orkambi barrels to the guinea pigs and investigated the clinical parameters, both the rate of edema, leukocyte infiltration, necrosis, and the level of serum amylase significantly decreased due to the Orkambi treatment. So this indicates that similarly to the energy restoration, the Orkambi treatment can also be beneficial in acute pancreatitis. So, and in the second part in my talk, I would like to briefly talk about the endocrine pancreas. So, in contrast to the exocrine pancreas, the role of CFTR in the endocrine pancreas is not as clear as in the exocrine pancreas. The main reason for this is that the expression of CFTR is different in different species. In the mice, it has been shown that in the mice, beta cells express functionally active CFTR chloride channel, genetical or pharmacological inhibition of CFTR in mice induce morphological and functional changes of the endocrine cells. In contrast, in the humans, a recent study has shown that CFTR is only expressed in a small minority of beta cells. So in the case of a human, the endocrine function is much more regulated by the exocrine CFTR body. So in order to get a clearer picture about the expression of CFTR in the mice, we did confocal and super resolution fluorescence microscopy. And as shown on these representative pictures, the CFTR chloride channel, which is indicated by the green color, is present on the beta cells. Even if it's not present in all beta cells, the CFTR expressed in the majority of mice beta cells. And those beta cells which express the CFTR, the highest density was observed in the plasma membrane, as shown on this super resolution fluorescence picture. So the pathological role of CFTR in the endocrine pancreas is more complicated. So it can be best illustrated by the cystic fibrosis related diabetes, which is one of the most common comorbidity of cystic fibrosis. Above the age of 40, approximately 80% of the women and 60% of the men develops diabetes during their lifetime, which substantially reduces their life expectancy, especially in women. So it's not a type 1 or type 2 diabetes. It's a special type of diabetes in which the inflammatory milieu in the exocrine pancreas destroys the beta cells, and this leads to insulin deficiency, and this leads to the development of diabetes. However, the exact pathomechanism is not completely known. Therefore, we did some preliminary experiments regarding the role and expression function of CFTR in the beta cells. So on this representative picture, the islets can be seen from wild-type mice and in CFTR knockout mice. As you can see, the islet is imaged in the case of, in the absence of CFTR. We also investigated the presence a number of beta and alpha cells in the islets, and we found that the number of beta cells decreased in cystic fibrosis. In contrast, the number of alpha cells significantly increased, and interestingly, the alpha cells shows a centralization in the islets. We also investigated the serum levels of insulin and glucagon, and found that in the absence of CFTR, the level of insulin significantly decreased, whereas the level of glucagon increased, which support the hypothesis that in the case of cystic fibrosis, the decreased the damage of the beta cells and the decreased insulin secretion can be responsible for the development of diabetes. So to summarize the role of CFTR, I can say that the CFTR play an important role in both the exocrine and the endocrine pancreas. Under physiological condition, play a role in the pancreatic ductal fluid and bicarbonate secretion in the exocrine pancreas, and in the insulin secretion in the endocrine pancreas. Under pathological conditions, ethanol decreases both the activity and the expression of CFTR channel, and corrections of the activity of CFTR by ATP supplementation or expression or can be beneficial in acute pancreatitis. In the case of endocrine pancreas, the absence of the CFTR chloride channel causes the damage of the beta cells and decrease the insulin secretion, which can lead to the development of cystic fibrosis related diabetes. However, in the humans, since there is only a few, so the number of CFTR channel is relatively small in the human endocrine pancreas. The exact role how the cystic fibrosis leads to diabetes in humans is not completely known and requires further examinations. Thank you for your attention, and I'm happy to answer your questions.
Thank you, Viktória. Over first.
Thank you very much. Yesterday, we heard from Joseph Mallet that there is a kind of co-localization of CFTR and the oral calcium channels, and that calcium obviously has an effect on CFTR. Could there also be effect the other way around, so that the calcium affects the CFTR, but the CFTR could also affect calcium, or that some of the effects that you see of the alcohol metabolites, which obviously has effects on the calcium, are actually mediated by changes in calcium?
Yes.
Have you thought about this?
I didn't put it into my presentation due to the time, but both the ethanol and its metabolites increase the calcium level in the ductal cells. So the effect of them is dose dependent. So at low concentration induce a physiological calcium signalization, which increases bicarbonate secretion, which related to the CFTR chloride channel. But at high concentration, it's induced more toxic calcium signaling, which can inhibit bicarbonate secretion. It's sure that these changes in the intracellular calcium level can affect the CFTR channel as well. And I'm sure that the CFTR also can affect the intracellular calcium by some way. So there is, I think, a paper that was published in this topic, and shows that the activity of CFTR can change the level of calcium, but it's not sure that it's released from intracellular organelles or from the access, or it has an extracellular source, but it also has an effect on the intracellular calcium.
Please.
Thank you, Vicky. I was hoping to hear about aquaporin, but not this time.
No, there was not enough time.
Maybe during dinner.
Yes, I'm happy to discuss.
So anyway, the mechanism of the CF-related diabetes, is that similar to the chronic pancreatitis-related diabetes, or is it different?
Yes, there is many overlap between the two types of diseases. So in both cases, the inflammatory milieu which develops in the exocrine pancreas can damage the beta cells and also the insulin secretion. So in both chronic pancreatitis or even in acute pancreatitis, the decreases in insulin level is the key point in the development of diabetes. And since the cystic fibrosis and the chronic pancreatitis are relatively close to each other, they have very similar pathomechanism. But obviously, there are some differences which is not clear yet.
So I wonder, is the function in the endocrine problems? So this is due to transport problems, or something is missing because CFTR do some master binding and activation, certain processes.
So in CFR,
what?
In CFR.
Yeah.
So
is it directly related to the lack of chloride transports, or some other functions of CFTR?
I'm sure that other mechanisms are also involved in this mechanism, especially in human, because in the human endocrine pancreas express only a few CFTR general. So in the case of the human, the absence of the CFTR general is so not the intrinsic CFTR general absence is responsible for the development of CFRD, but the ductal CFTR general has some kind of interaction with the endocrine beta cells. So I think it's an indirect connection between the ductal CFTR, and the loss of the ductal CFTR can affect the endocrine function somehow, but the mechanism is not completely clear. So probably some signaling mechanism play a role in it, and
what happens to other ion transporters? Because also when you deplete actually the ATP, I mean, that's probably not only the CFTR which is affected, but the whole, I mean, the uploading of chloride and bicarbonate to the cell is also affected. So do you look actually other?
Yes, because there is a close interaction between the CFTR and the chloride bicarbonate exchanger. The image of the CFTR is probably affect the function of the chloride bicarbonate exchanger. So in the case of cystic fibrosis, the bicarbonate secretion decreases and the fluid secretion. So this probably have an effect on the somehow on the endocrine function as well.
So question about when you used workup, was it the same range as it used in human?
No, it was normalized to mice, but we used the same concentration what we used in the humans, just we normalized it to the mice.
So in that range that it
yes.
And could you try the Cftr and the Cftr as well?
Cftr
and the Cftr and the triple combination.
Oh, triple. No, just this dual combination, the Cftr and the Cftr.
Because you might even more increase the expression.
Probably. Yes.
And do you think that this kind of treatment would be an option also for the other etiology coming, like
yes.
other than the alcoholic etiology?
Probably, yes. Because what we induced, the pancreatitis in the mice, was not an ethanol-induced pancreatitis, so it was a cerebrine-induced pancreatitis. And in this case, the all compound did work. So I guess that in the case of other etiology, if the CFTR4 channel is diminished, in that case, the all compound can be beneficial as well.
It's very interesting as the mortality is, as you mentioned, it's very high.
More questions? Or if not,